This segment is sponsored by UnitedHealthcare.
It's officially open enrollment season, and for those enrolled in Medicare, this is a particularly critical time. I'm joined by Caroline Anderson, Executive Director of UnitedHealthcare Medicare and Retirement of Virginia. Good morning, Caroline.
Good morning.
It is so important that we have this conversation because in this day and age, as we think about healthcare, we've got to make sure we've got our ducks in a row, if you will. So for seniors and others who are enrolled in the Medicare programs, why is open enrollment so important?
Yes, so for those who are enrolled in Medicare, the annual enrollment period is your only chance during the year in most cases to change your plan. So it's really important to take a look at your plan, make sure it still fits your health and your wallet. And if you need to make a change, now's the time to do it.
Definitely. And being able to make that change requires a little bit of knowledge and research at times. So it could be overwhelming for some. What advice can you offer to help make the process of choosing a plan a little bit easier?
It can be complicated, but we're here to help. First, I would say it's really important to check your current plan and make sure it still meets your needs. Second, think about if there's any changes to your budget that may be different than last year. Pay attention to more than just the premium of your plan, the monthly premium, but your out-of-pocket costs, any deductibles, co-pays, co-insurance that you might have. With UnitedHealthcare, for example, most of our Medicare Advantage plans have no copay on telehealth visits, labs, routine vision and hearing exams, many other things. So that's really important. And then lastly, make sure that your medications are covered.
You said something really critical there, and that was looking beyond what you pay on a monthly basis to make sure that it really does have the coverage that you need, not only for your medical visits, but also the medicines that you may need to take. So when you're looking at the actual plans, what are things people should be looking for to help make them, to help ensure that they can remain healthy?
Yeah, definitely. And make sure that the doctors and hospitals that you like to use are in the network. That's really important. Most Medicare Advantage plans also cover telehealth visits. So think about that as we're in this pandemic, people are accessing healthcare in different ways. Telehealth might be something you hadn't tried before, but that is usually covered under Medicare Advantage. So that's important. Second, don't forget about dental coverage, vision coverage, other kind of extra benefits you might not know are included in Medicare Advantage, but those are really great things to take a look at, lots of extra value to you there. And then lastly, wellness programs. There's a lot of great fitness or mental fitness programs that can be in a Medicare Advantage plan. At UnitedHealthcare, we have access to Renew Active, which is a great benefit. So look at more than just the costs and co-pays, but at those extras that you get too.
And you mentioned the Medicare Advantage plan. I know that I've heard more about that in recent years. What is that Medicare Advantage plan, and what do you think is driving the growth that we're seeing or hearing about?
Sure, yes. Medicare Advantage is a combination of Parts A and B in Medicare, those traditional pieces that you hear about. Sometimes it's called Part C. So it takes Part A and B and combines it into one plan, which is offered by a private insurance company like UnitedHealthcare. It has grown more than 40% in the last 5 years. More than a third of Medicare beneficiaries are in a Medicare Advantage plan. So it's becoming really popular because it combines all your coverage into one plan and it's very simple. In addition, Medicare Advantage also offers those extra benefits I talked about, the vision, dental, hearing, fitness membership. So there's just a lot of extra to it. That's great. Prescription drug coverage is also included in most plans. And Medicare Advantage just offers peace of mind through predictability. With original Medicare, you usually pay 20% out of pocket for everything that you use in healthcare, but a Medicare Advantage plan has an out-of-pocket maximum annually. And so if you have some really big health event, you know that your costs will be capped.
We've got about 30 seconds left, so I want to make sure that we definitely cover this. As folks are making these important decisions in the next couple of weeks, what are some resources they should be aware of if they need support in choosing?
There are a lot of great resources out there to help you make a choice. If you'd like more information about UnitedHealthcare plans, you can visit uhcmedicarehealthplans.com or give us a call. Or for more information about Medicare in general, go to gettoknowmedicare.com.
Fantastic. Thank you so much for being with us. This is such an important time of year, a time that we all should be taking advantage of, especially those in the Medicare programs. We appreciate you for sharing the knowledge.
Thank you.
For those of you who are interested in learning more about Medicare, Medicare Advantage, or the annual enrollment processes, please make sure that you go to our website right away at wtvr.com/VTM.
For more information on the UnitedHealthcare plans, visit uhchealthplans.com. You can give them a call at 844-645-4556. For more information about Medicare, visit the Medicare Visit. Get to know Medicare.com is the site there. All right, Jess, a couple of things here from someone who's actually enrolled in Medicare. It is a government program, so it's not easy. But I think that's probably for a good reason, is because everybody has their own individual needs and wants, and so therefore, it is not one size fits all because everybody's different.
No, you're spot on. And while I'm not there in terms of the program, certainly I have family members who are, and I just feel like there is so much to consider. Number one, if you're brand new to this and you're approaching Medicare age or are there and maybe you're enrolling for the first time, I can't even imagine the questions that you have. And then if you have already been enrolled, you only get to do this once a year, like they said. So it's a key time to be able to review what was working for you, maybe where you needed to beef things up or dial back a little bit. But you're right, it's one for all, but so unique within it. So there are so many questions.
Yeah, and like I said, don't try to do this by yourself unless you're really good at deciphering medical/government talk. And they're both a little confusing for most of us. So yeah, it's not an easy thing to figure out. So I don't suggest trying it alone unless you got somebody that really knows what they're talking about. And obviously, our friends at UnitedHealthcare were there to help. And obviously, I don't think anybody that's ever opened it up said, "Oh yeah, I can do this by myself." Like, nobody I know anyway.
Well, I guess it falls under the idea of there are strength in numbers. So
Yeah.
let's go talk with the expert, but probably do your homework before you make that call. Make sure you've got your information together because you'll be able to maximize that advice that they share with you when you make that call. But hitting the health, hitting the wallet, two key areas for all of us. So it's a once a year opportunity. And I guess look at it, let's just do the reframe. Just like I'm previously enjoyed or previously loved and not previously, what was it, disgusted? He said on my shirt.
December
Go
7th.
into it with the
There is a
power of
deadline for this.
positivity.
December the 7th. All right, stay tuned, folks. We'll be right back.